And what do you think of buffet syndrome offerings? Is it still prevalent like you mentioned?
Yes, it's still quite prevalent. Otherwise, we will not be so concerned about, rising healthcare costs. So there is, again, probably a small pocket of patients and doctors who are over-consuming. I think the vast majority, such as your BT reader, we are not making claims or unnecessary claims, right? Yeah, so we try to be responsible in our own consumption of healthcare, but we need everybody to have that mindset.
Hello, welcome to another episode of 5 Questions with from the Business Times. I'm Sohana, and with me today is Dr. Wee Hui Lin, Domain Leader for Health Systems and Policy at the Saw Swee Hock School of Public Health. Thank you so much for joining us today, Dr. Wee.
Thank you for having me.
So today we're going to tackle the issue of surging insurance premiums. Could you first shed some light on the issue and what's driving it?
So I think there are several reasons why the insurance premium is increasing. So 1 in 4 Singaporeans by 2030 will be aged 65 years and older. We have an aging population, meaning that people are getting older. And we're also living for a longer period of time. So there are more people who are aged 80 and above. And then the third is that with aging comes increased prevalence of chronic medical conditions. What it means is that more people are consuming more healthcare services, right? The number of claims will increase. Yeah, the bill sizes will increase. On top of that, we see an increase in the cost of providing those healthcare services because we have to pay more to attract people to work in healthcare. Yeah. And the cost of technologies are going up as well. So we're paying more for better technologies. So people are getting older, getting sicker, and that explains why the bill size has increased so much. Yeah, that's probably a bigger factor than overcharging. I would say a small number of doctors may overcharge. Yeah, and they have been pulled up by the ministry, right? Yeah.
So 6 out of the 7 insurers that offer integrated shield plans have increased their premiums in 2025. Why is this happening and what's your take?
I think it's not surprising. It started first of all with the MediShield Life Premium Review. Yeah. And then we had an increase in premium for MediShield Life itself. The committee reviewed and realized that actually we need to ask people to contribute more for the premiums. And because the integrated share plan is on top of MediShield Life. So when the premium for MediShield Life increases, it's not a surprise, that private healthcare insurers will also increase their prices. And we saw this same pattern in the previous review.
On that topic of the Integrated Shield Plan, BT received a letter from a reader titled, "The Integrated Shield Plan is Broken." In it, he described that he saw a 48.3% bump in his IP premium and a 70.7% jump in premiums for his Plus rider. This occurred after he made no claims for 20 years, up until 2 years ago. How valid is his statement, or do you think there's other factors that contributed to this?
Yeah, so I'm not exactly sure since this is an individual case, but in general, we do see an increase in premium. On average, there's probably a 20% increase year on year. Yeah. And for this particular reader, maybe because he crossed over to a different age bracket. So for myself, I'm paying about $2,000 for a integrated share plan with rider, whereas my mom, with exactly the same plan, she's actually paying $8,000. Yeah, so that's 4 times more. So age plays a factor. And your reader mentioned that he hasn't made a claim, right? So why is my premium increasing if I haven't made a claim? Well, the thing is that insurance is about risk pooling. So many people with different level of risk will contribute. So even though you're not making a claim, someone else's in that pool is making a claim and maybe making a very high claim, right? So if you have a large number of people who are making a lot of claims or very high claims, then overall, everybody has to pay more for their premium.
His letter garnered some strong responses online. Some said the insurers are unethical for not allowing coverage switching due to age or pre-existing conditions, while others said that they're profiting at the expense of citizens. Are these strong ground sentiments justified?
Well, as a consumer, if I'm affected, I think those comments are definitely justifiable. Yeah, but I think perhaps we might want to take a broader view. Everybody in the healthcare ecosystem, the insurance companies, the Ministry of Health, the doctors, and hopefully the patients as well, are all doing our parts to try to minimize the healthcare costs, right? For example, pre-authorization. Yeah. So it's a mechanism where the doctors will need to submit a request to the insurance company, and the insurance company will then say, yes, I will pay, or I will not pay, or how much I will pay. So that gives the patient, the doctor, some form of reassurance about what can be covered and what cannot be. The downside of that is that people will start to think this is how insurance companies will try to deny claims. Yeah, but we try to have clinical guidelines to help to inform what is reasonable and what is not.
Yeah. In October, Health Minister Ong Ye-kung suggested benchmarking private hospital charges beyond the professional fees that are already covered. What do you think about this proposal?
I think it's a great idea. So for benchmarking, of course, we need to be mindful that you should not benchmark down to the item. Yeah, there should be some broad categories like surgeon's fee, daily treatment fee, very broad categories. Otherwise, it gets very onerous for everybody, right? The administrative burden of monitoring those claims. Other than benchmarking, research has shown overseas that when you provide like a performance indicator to the individual doctor, anonymized feedback, it helps to drive behavior. Did you know that your peers are charging within this range? Yeah. And this is where you are.
I now want to talk about employment. So a recent study by Mercer Marsh Benefits expects that employers will reduce coverage for their employees for the first time in 4 years. What do you think is the best way for employers to deal with this cost of rising insurance premiums?
That's a good question. Yeah, so it's affecting everyone, right? Not just the consumers, but also the employers as well. So there is actually a mechanism that is adopted by some companies, but maybe not so widely adopted, which is instead of paying for the insurance, you actually do a MediSave top-up for your employee and for them to decide like the kind of coverage that they want. And personally, I think that this is better because then the coverage will follow the patient. So I pay for my own private insurance because that's the one that I carry with me no matter what job I am in. Whereas the one offered by my employer, I cannot carry it around. It's not portable. Yeah. So I end up, or rather the system end up paying twice for the same kind of coverage that I need. But I must say that you need to provide your employee with that peace of mind as well. Yeah. So not everybody can afford to pay for the premiums of a private health insurance all by themselves.
How do you think Singapore's health financing model should evolve to remain fair, sustainable, and protective of vulnerable groups?
I would like to think that we have a very robust healthcare financing system. In fact, one that many countries want to learn from. So we have the 3M plus S system. So the 3 M's would be MediSave, MediShare Life, MediFund, and then subsidies by the government, right? So in fact, the government subsidy actually covers a huge chunk of our healthcare consumption in the public hospitals. Yeah. What we need to work on is probably more of the consumption behaviors and then maybe try to see how we can lower the healthcare inflation in terms of managing the cost of healthcare technologies, for instance.
Yeah.
We have an agency for care effectiveness that looks at the use of health technology assessment to make sure that we are getting value for money. If we were to subsidize this technology, it will give us the health gains that will be meaningful to the healthcare system, to the patient.
Some have suggested completely eradicating the private health insurance industry in Singapore and moving somewhat towards what Germany has with a national health insurance system or what the UK has with the publicly funded health service program. Do you think that's applicable to Singapore?
Well, I think different healthcare financing systems has its pros and cons. So if we move to a fully public healthcare system, then I think we can anticipate the waiting time is going to be much longer than what it is right now. Moving to a social insurance system, like in Germany, then it might mean actually that we have to pay a lot more out of pocket. Yeah. And I think personally as a consumer, I want to have choices.
Yeah.
Maybe I feel that I really need to know what is wrong with myself. I need to get that diagnosis out in as short a time as possible, I would like to have the option to go to a private hospital. Yeah. And I think most Singaporeans will be shuttling between the two. Yeah, so to completely remove one option, I think may not be very popular. Yeah.
But do you think there is a role for the MOH or the government to step in and slow this hike in terms of the premiums?
Oh, they have been doing a lot.
Yeah.
Yeah, so, Minister has been very active on social media, trying to educate the public, asking them to think twice whether you really need that rider. So in the past, maybe it's rider or no rider. But now, I think among the riders, you have got different levels of coverage. So for instance, I just downgraded my mom to a full option, any private hospital rider, to something less because I can't afford her premium. But she still gets the private hospital option. It's just a smaller group of hospitals that she can go to.
Okay.
But it still gives her that option in case she needs to have something done very quickly and I can't get it in the public sector, right? Yeah. But health insurance is happening on an annual basis. You renew it on an annual basis, right? So I reassess every year. Maybe at the age that I'm at now, I can afford a $2,000 premium. But when I am at my mom's age, can I still afford? Yeah, 4 times more. Yeah, so I think it's an assessment that we have to do every year. Yeah.
Yeah, but there are 7 healthcare providers that provide the integrated shield plan in Singapore. Do you think that's sufficient or too much? Do you think the market should consolidate?
Wow, that's a difficult question. Yeah, I think we have to let the market, dynamics play out by itself. So, are we having too many insurers? We know that many of them are losing money. Yeah, then it's their business decision as to how they want to move forward, whether to consolidate or whether to pull out of the Singapore market. Then again, I was looking at the data over the last 20 years. So initially, they were making quite a bit of losses. Then after that, several interventions came in, both from the ministry as well as within the industry itself. Yeah, and we see that, slowly they are getting into the black. So maybe they are getting things right. Yeah.
So in your view, do you think insurance premiums will continue to rise at a rate of 20%, or do you think it'll slow down?
I'm certainly hoping that it will slow down. Yeah, and I see that everyone is putting in efforts, right? The private insurance companies, the ministry. So I'm very hopeful that it will slow down, maybe not immediately, but gradually, to something that's more manageable.
All right. Thank you so much for sharing your insights on this topic, Dr. Wee. We really appreciate you sharing your expertise with us today.
Thank you for having me.